Okay. Hi, my name is Ashley Anderson, and I will be doing my presentation and research study on adjustment disorder. Okay, so this is just a brief definition of what adjustment disorder is. Adjustment disorder is a maladaptive reaction to an identifiable psychosocial stressor or multiple stressors that usually emerges 3 months of the onset of the stressor. An example of a maladaptive reaction would be something like a person may have lost their loved one to incarceration. It is an exaggerated expression of being stressed out or maybe even depressed or responding as the book or DSM-5 would say abnormally to something that's insignificant. Another example of a stressor that would be common for adjustment disorder would be something like parents splitting up or divorcing, or a child who may have a sibling that has been born into the family, a family having another baby. That would be an example of a stressor. And then it occurs within 3 months of the stressor. This is very significant because unlike PTSD and acute stress disorder, this can happen immediately. It cannot last any longer than 6 months. If adjustment disorder is longer than 6 months, then you will automatically be upgraded to PTSD. Symptoms. So these are some of the symptoms of adjustment disorders. It would include insomnia, which is difficulty sleeping, crying spells, hopelessness or sadness, reckless driving, difficulty concentrating in school and work or any other social setting, social avoidance of family or friends, suicidal behavior potentially, ideations or attempts, anxiety attacks possibly, expressing desperation or constant worry, and lack of enjoyment in activities once enjoyed. So this is the diagnostic criteria according to the DSM-5. It would include marked distress that is out of proportion, as I stated in the previous slide, due to the examples such as an incarcerated loved one or a baby being born to the family, etc. So it will be marked distress that is out of proportion to the severity or intensity of the stressor, taking into account the external context and cultural factors that might influence symptom severity and presentation. Significant impairment in social, occupational, or other important areas of functioning. What that basically means is that you can deal with some of something significant, as in losing a loved one in incarceration, or losing a 90-year-old grandmother who didn't have a sickness, but just it was time for her to go. These things could impact you, but if it doesn't cause a significant impairment in social, then there's no need to diagnose a person with adjustment disorder, especially if they're dealing with it. The stress-related disturbance does not meet the criteria for another mental disorder, and is not merely an exacerbation of a pre-existing mental disorder. So basically what that means is that everything else has been ruled out. There's no history of bipolar, depression. There's no possibility that the person can be diagnosed with depression. They do not meet the criteria for that, or schizophrenia, whatever the case may be. The symptoms does not present normal bereavement. For example, I'll use myself. For me, my fiance is incarcerated, so if I constantly grieve over it for over 6 months or even a year, then it's possible that it could be something else, or I'm just exaggerating the situation. It would, and I don't meet any other criteria for any other diagnosis, so it would more than likely line up with adjustment disorder. Although I do not agree with that, this is according to the DSM-5. So this is a differential diagnosis and also the rule out. So this just tells the difference between PTSD, acute disorder, and adjustment. it separates the two. So for PTSD and acute stress disorder, the exposure to actual or threatened death, serious injury, or sexual violation to both of these two. But for adjustment disorder, the stressor can be of any severity. It doesn't have to be the person was exposed to anything in particular. The person, it doesn't have to, for adjustment disorder, it doesn't have to happen to that person directly. It could be any situation. For example, a child may have a sibling born into the family and it's new, it's an adjustment disorder. Nothing has threatened the child. There's no serious injury or sexual violation. Also, PTSD and acute stress disorder occurs within 3 days and 1 month of exposure to the traumatic event, versus adjustment disorder is diagnosed immediately and persists up to 6 months. So, these are the adjustment disorder types. It could be with depressive mood, with anxiety, with mixed anxiety, and depressed mood, with disturbance of conduct, with mixed disturbances of emotions and conduct, and it also could be unspecified. But I would not use unspecified if you're working in a mental health facility, because you will not be be able to bill for that service. So causes in children and teenagers. So some of the things that can cause this is family fights or problems in school. It could be just if you're new to the environment and you're just not fitting in. The setting is just not the right place for you right now. You're just not a good fit for the environment. It could be you're not getting the attention that you need. It could be you can't be yourself because everybody else is going their own way. Anxiety over sexuality. It could be you may just be coming out. You may just be experiencing your sexuality, or you may be trying to cope with what you are as far as sexuality. These can be things that can cause an adjustment disorder. So these are your treatment options. So you have psychotherapy, crisis intervention, family group therapy, which is effective. Of course, support groups, CBT, which is cognitive behavior therapy, and interpersonal psychotherapy. So if necessary, these are some of the medications that are prescribed for adjustment disorder. And I apologize for pronouncing it the way I do, because I'm not sure exactly how to pronounce it, but benzodiazepines, non-benzodiazepines, and SSRI and SNRI, which are antidepressants. And if necessary, these are some of the medications, the most common medications that a person takes when they have to pursue medications if therapy is not an option, or if it's not effective for the client or the individual. So the conclusion with adjustment disorder, and what's important that an individual or any clinician needs to go over with a client, is to definitely develop a strong network of people to support. I think support is a very strong attribute when a person is suffering from adjustment disorder. Oftentimes a person may feel like they have absolutely no one to talk to because they have not been in the same predicament that that person has been in, but just letting a person know that they do have support and people that may be willing to help them cope through the situation is very, very important throughout the therapy process. And also living healthy, finding something, getting back to the place and things that you've done that actually made you happy, that actually made you content with life. That could be exercise and working out, hanging out with friends, whatever the case may be, or whatever you was doing before the situation or event or stressor happened. So living healthy is a very important factor. Also, establishing good self-esteem. Knowing that whatever the situation that occurred is not your fault, just knowing that it's nothing that you could have done to prevent it, whatever the stressor was, and knowing that you can move past it. And so, yeah, for establishing good self-esteem. And these are my references. Thank you so much for listening, and I hope you were informed by this presentation. Thank you.